Hi again, everyone. So we are just a couple minutes ahead of schedule, and again, waiting for people to join. I know it's early, so especially in some parts of the country. So as we wait, I did just want again to mention that we've got this amazing initiative going to let FDA hear our voices and know that they need to protect our kids and complete their regulatory duty to regulate all flavored e-cigarette products, all e-cigarette products. And as you can see in the chat, I'm just checking right now. If you look at the link in the chat there, you can link to this Take Down Tobacco and sign a letter and tweet or share on social media your message to FDA that it's time for them to take action.
Right. And just to reiterate, hi, Doreen, I'm just jumping in. We really appreciate the Campaign for Tobacco-Free Kids for giving us, I guess it's called a power wall. And it actually, I think it sends you social media content with what you've tweeted, I believe. But again, the issue is that by saying that it could take another year till June 30th, 2023, before they complete the pre-market regulatory review process, that means, it seems, because they have not used their enforcement discretion on the products that are already 8 months past the federal court ordered deadline, these products, these flavored products, will remain accessible to teens. And we know that because we know from the federal surveys that there are currently millions of kids using these products. And in particular, we're concerned, FDA, which has done an enormous amount of work and has removed from the market, has given marketing denial orders to so many products already because they were really overwhelmed with millions of applications. But the market leaders remain out there, the biggest, including Juul, including menthol Juul and other menthol products. FDA has repeatedly said they are setting aside the menthol e-cigs. And as we'll hear later in a bunch of conversations about the federal regulatory update and about new products, menthol e-cigs are among the most popular with teens who vape. And menthol, as we also talked about yesterday, because of the historic move to end the sale of menthol cigarettes, the science that FDA presents about why menthol is so dangerous and such an initiator of youth tobacco use is the same for menthol e-cigs. We know kids are using them. So we urge all of you to urge FDA to decide immediately, remove those products off the market until you're finished with the review, and don't let it drag on for another year. So please go to takedowntobacco.org/PAVE, PAVE, and send your message.
Great, thanks, Meredith. Now I'm very excited to introduce our next session, Beyond Punishment: Alternatives to Suspension and Restorative Approaches to School Policy. I would like to introduce our paid volunteer, Patty Nazmiel from New Jersey, who is going to introduce this panel for us. Patty is one of our earliest volunteers and has been with us for several years, and we're so thrilled that she's here introducing this panel. So we're going to play the video and then dive right in.
Hello, my name is Patty, and I'm a paid volunteer from New Jersey. I became a PAVE advocate when I saw firsthand and experienced the harm the e-cigarette industry was and is still doing to our youth population. As you know, nicotine and other substances in e-cigarettes are quite harmful and addictive. I'd like to take a moment to thank one of our visionary sponsors, the American Heart Association. The American Heart Association is the leading force for a world of longer, healthier lives. With nearly a century of life-saving work, the association is dedicated to ensuring equitable health for all. To help combat the tremendous toll tobacco use and nicotine addiction have on our country, the association supports policies such as providing adequate funding of tobacco cessation and prevention programs, eliminating flavors in tobacco and nicotine products, implementing or increasing tobacco taxes, expanding smoke-free air laws, raising the minimum purchase age, and ensuring strong government oversight of the manufacturing and marketing of all tobacco products. These policies can lead to significant reductions in tobacco use and result in health and economic benefits. Through the American Heart Association's Tobacco End Game movement, young people ages 13 to 24 can directly support these campaigns. By joining Tobacco End Game, young people can contact their elected officials through email, phone, social media, office visits, and virtual meetings. They can also testify at legislative meetings and hearings. They can participate in rallies, state houses, in schools, and their communities. They can also connect with young people across the US through coordinated social media campaigns. They're also able to share their personal stories through blogs. They can also build valuable volunteer and advocacy skills that will last a lifetime, and many more. The association invests in young leaders through training, empowering them to develop campaign strategies, and amplifying their voices through websites, social media accounts, and media advocacy. Please encourage the young people you work with to join the movement by visiting tobaccoendgame.org or texting ENDGAME to 46839. Thank you, American Heart Association, for all you do. And here's our next panel. Thank you.
So our next panel is about to start. We have Elizabeth Cook, who's the Senior Director of Whole Child Health at Alliance for a Healthier Generation, Sharonica Hardin-Bartley, who is the Superintendent of Schools at the School District of the University City, Jeff Willett, our partner and Vice President of Integrated Tobacco Strategy at the American Heart Association. And the panel will be moderated by Rachel Callahan, who is the Senior Staff Attorney at the Public Health Law Center. And this is an incredibly important conversation, and we are so thrilled to have you all. So I'm going to get off now, and thank you all.
Great, thank you, and welcome everyone to this morning's panel discussion, Beyond Punishment, Alternatives to Suspension and Restorative Justice Approaches to School Policy. I do really want to thank PAVE for highlighting this as a topic in your annual conference. It is just such an important discussion to have, so it's going to be a really interesting one. I do want to just recognize that all of our hearts are very heavy today, knowing, just 24 hours ago, the life-changing event for all of us with the shooting in Texas. So I do want to acknowledge that and, understand that I believe a lot of what we're going to talk about today is actually very relevant in the context of whole child and health supportive approaches to youth, and especially mental health focus. So with that, my name is Rachel Callanan. I am a lead senior staff attorney at Public Health Law Center. We provide free legal technical assistance across the country on commercial tobacco control policies, including K-12 school policies, such as what we're going to talk about today. Through the support of Minnesota Department of Health several years ago, Public Health Law Center was able to develop a model K-12 policy. And we really very intentionally chose to focus on a framework that created an alternative to suspension, which in Minnesota, and probably most states, that was the go-to kind of easy approach to discipline for commercial tobacco infractions. And so we really intentionally worked with our partners in Minnesota to develop this alternative framework and alternatives to suspension. And I did put in the chat a link to our document that explains our approach to alternative penalties. And I also put in the link to the Alliance for a Healthier Generation and American Heart Association resources. So you can see those there. We know that exclusionary policies like suspension from school and extracurricular activities contributes to negative educational and life outcomes, can really undermine our schools and communities' goals for supporting healthy student development and resisting the addiction of nicotine, but also resisting the marketing, intense marketing that the industry pushes to our youth and the peer pressure that youth experience. So with that, I am excited to introduce our panel today, a group of really incredible leaders and groundbreakers in this area. I'm going to start by introducing Dr. Sharonica Hardin-Bartley. She is superintendent of the school district of University City, Missouri. I saw someone chatted what states that's in. And she began that role in 2016. She serves 2,600 students and more than 400 teachers and staff. She brings a hands-on approach to the superintendent role and is committed to enabling teachers and students to embrace and truly live their passions for education and learning. She has spent 26 years relentlessly championing educational excellence and equity for all children. Elizabeth Cook is a senior director at the Alliance for a Healthier Generation, where she leads their whole child resource portfolio. She's a lifelong educator, school psychologist, and has supported educators, youth, and families at the local, state, and national levels. She really immerses herself in all of these roles, which gives her a 360-degree view of how real implementation happens so that she can successfully translate theory to practice. So she's a great asset to the Alliance for a Healthier Generation. Dr. Jeff Willett is a vice president with the American Heart Association, where he leads the Heart Association's tobacco endgame strategy, which is designed to eliminate the tremendous health impact caused by tobacco use and vaping. He has an extensive background directing and evaluating comprehensive tobacco prevention and control programs, including serving as a research scientist with the New York State Department of Health and as a vice president with the Truth Initiative in Washington, D.C., which is a foundation focused on preventing and reducing youth tobacco use. So with that, I'll start off with our first question, which is for you, Sharonica. We'll kick off the discussion by first defining the terms that we're using. So from your perspective, what does it mean to take a restorative approach in school discipline? And also, what does it mean for schools to use or consider alternatives to suspension?
Morning, everyone. I share all the sentiments that have been conveyed earlier in a very sobering space right now. I'm actually at a school, so you may hear little people in the background. I'm at our early childhood center, which is a space that I often come to when I need a feel-good moment. So thank you for engaging today. It's great to see so many individuals interested in this topic. And so restorative practices really is a way of really doing things with students in lieu of to them. It removes a lot of the punitive, practices and approaches to responding to student behavior, no matter what that behavior might be. In this instance, we're specifically speaking about tobacco use and vaping. And one of the things that I have noticed as superintendent, and particularly as we have responded to the global pandemic, our children are working to cope. They're really working to just survive. And now more than ever, we need to be more humane, have more empathy. still understanding the significance of behaviors and wanting to, help them understand the consequences and the impact that their behaviors may have on others. But that's really restorative practices, really understanding what harm has been caused, how that harm has affected the school environment, how it has affected the student, how it has affected others, and giving them alternative ways to address those issues, really working to repair that harm and having students be a part of that repair. They have a lot of great ideas. Oftentimes they are very empathetic and they understand the harm that has been caused and they want to make it right. But most often we don't give them the choice or the opportunity to do that. We just immediately go to the black or white discipline. So with our approach, we don't have a lot of black and white because our children are not, there's a lot of gray areas. And so we really work to look at unique circumstances. We work to look at the frequency. And again, our goal is to repair the harm and to be sure that the behavior is not repeated. So that is why we feel that a restorative approach specifically to this topic and these types of infractions is essential. We must be more restorative and not continue to punitively discipline and harm, re-traumatize students who are already navigating a lot of significant trauma in their day-to-day lives.
Great, thank you for that, Sharonica. Jeff and Elizabeth, do you want to add anything to sort of set the stage for what we're talking about?
I mean, I would just say, Sharonica lives this every day in her role as superintendent, So nothing to add other than, reiterate what folks said about yesterday's events and how critically important it is, that we prioritize student well-being and mental health as we move forward, as a society. So nothing more to add than that.
All right, well, great. My next question is for you, Elizabeth. So what are the risks of schools solely focusing on punitive policies for commercial tobacco infractions or other school policy infractions? And anything to add about the risks of not, go ahead with that first question, sorry.
Yeah, thank you. And, thanks for PAVE for having us here and setting up this panel. I kind of echoing the sentiments that were said earlier. I have 2 young children and I dropped them off at school today, right? And like all parents, always have in the back of your mind. And there was part of me that was like, oh man, I'm gonna do this panel today. And then I was driving, I was like, oh no, actually, like this is super important and really important as we think about kind of what our big goals are as an education institution, right? Which is teaching and learning and ensuring that all of our youth, right, have what they need to feel well and healthy and supportive. And so I just want to re-echo the fact that I think that this is a really important panel to have, and I'm very grateful to have the opportunity. Not to be overly simplistic here, but what's at stake from my perspective, and I think the research would support this, is exactly what this panel, what this entire conference is trying to prevent, right? Which is individual youth engaging in tobacco use and other substance use. And what we know from the research, and Sharonica will speak from that, but also like as Jeff said, her deep experience here. We know that when we put kids out of school, right, when we suspend them or we expel them, it makes it worse, right? It's not helpful, and in fact, it's harmful. We know that individuals that are suspended or expelled are more likely to engage in tobacco and other substance use. We know that they are less likely to feel safe and supported and connected to their school environments. We know that we see increase in mental health issues and certainly academic outcomes, right? Like if you're not at school, you can't learn stuff that you're trying to learn in school. And so really on the most basic kind of simplistic reductionist idea of it, what's at stake is exactly what we're all here to try to solve for and try to prevent. And I want to add some additional depth to that when we think about some of the equity components and intersectionality between how we as a school system, and I use that in the rural we term, right, as an educator myself, I'm also deeply embedded into the school system, how we as a system overly apply the suspension and expulsion policies and procedures to our students of color, particularly our Black youth, particularly our Black male youth. And then we think about sort of the predatory practices in the tobacco industry in terms of, how tobacco is marketed, right, to youth and particularly youth of color. And we see that sort of intersection there. And so to me, this is not just a whole child health issue. This isn't just a nice thing to do for kids because we want to be nice and friendly and supportive, but it's actually a harm reduction, right, to ensure that our youth are getting the learning that they deserve, that they're entitled to, and particularly from an equity perspective, that we're really taking a look at the additional harms and burdens that we cause our students of color when we engage in these type of practices. So a lot is at stake, to be quite honest with you. And that's why I'm so glad we're starting to have this conversation, and we're seeing schools and districts more and more embrace this idea of, hey, this sort of way that we've done business before isn't working, it's not effective. And so what do we need to put in place to ensure that kids are really being held accountable for what they're doing, right, with high supports, right? So we can really start teaching folks, what does this mean for you and your body? What does this mean as it relates to your peers? What does it really mean as it relates to your school community? And who do you want to be within the school community? And who as a school community do we want to be? Sort of what's our big goal here? So, just a few things, Rachel, at stake.
Yes, thank you, Elizabeth. Jeff and Sharonica, do you have anything you want to add to what Elizabeth was saying about the risks of not pursuing this approach? All right, great. So my next question is for you, Jeff. So from a public health standpoint, what are the opportunities that more supportive policies present?
You bet. Great question. So public health is the science of preventing disease, and whether the disease is addiction or the other diseases caused by tobacco and vaping, schools are uniquely positioned to use restorative approaches for improving the health of their students. With public health, we often speak about changing the environment. So the healthier environment or the healthier choice is the default. And we also consider how health interventions can improve the health of as many people as possible. So schools are uniquely positioned to impact youth vaping because, first, compared to any public health organization, schools can much more easily identify young people who are vaping and who need help. They have a direct connection to young people and can see the behavior. Second, schools can create an environment in which students feel comfortable and are encouraged to reach out for help when they want to quit. And we know that many young people who use tobacco products want to quit. And then third, by providing restorative approaches, including evidence-informed cessation support, our schools can help put students on a healthier path and avoid future disease. So through restorative approaches to student vaping, the school system as a whole in a community or a state can positively impact thousands of young people who've been the victims of the tobacco industry. And that potential public health impact is incredible. And as Elizabeth mentioned, the potential harm of more punitive approaches is something that we absolutely need to avoid.
Yes, all really important points. Anything the two of you want to add, Sharonica or Elizabeth? All right.
No, I think that's spot on.
So Sharonica, with your experience as a superintendent, can you just paint us a picture? Some of us are not, my kids are out of school, so I'm not directly engaged with the education system any longer. But you've been a superintendent since 2016. What are the changes that you're seeing on the ground with student commercial tobacco use, especially with e-cigarettes, which we know is kind of the hot product these days?
I think that there is a deliberate and intentional marketing strategy with these providers that are targeting and honestly successfully attracting younger people. The e-cigarette looks very different. I've seen them as a key fob. I've seen them as like a jump drive. They have cool colors, they have scents, cool titles. So students want to be cool. So those things are cool. I don't think that they even understand the implications of it. That's one piece of it. So I think there's an intentional marketing strategy to the population that I serve. The other piece that I've seen more of an increase is just around usage. And I shared this earlier. Students are stressed out. The suicide rate has significantly increased. This little thing, the two words that I say, social media, depending on how you use it, the context is different, but social media has really exposed students to a lot more of the traumatic experiences that they are navigating. And so they're coping. And it's not necessarily about the impact that the usage has, it's the immediate in their perception and psychologically and physiologically, the immediate relief that they are getting from this drug. And I'll use that word because I think it is a drug and it's impacting our students in that way. And so the stressors that they're navigating, COVID-19, the lack of connection, the racial unrest in our communities and our environments, the blatant attacks on schools as we're seeing today, that's stress. And we can't put our students in a bubble and just say, oh, we're going to shield you from all of these societal woes. They're living it every single day in a way where we have never been as connected as a society as this generation. And so the usage is about coping, I believe. And then what that leads to is addiction. And it's difficult for them just to stop. So there are many, many factors, but the main ones that I see are the blatant marketing strategies to attract them to usage, and then just their needing and desire to cope and just navigate this thing called life as a young person, where the stressors are much more significant than they have ever been in any of our lifetime.
Thanks, Sharonica. And I just as a follow-up to what your comments, I'm considering like exclusionary policy, school suspension, exclusion from extracurricular activities. I mean, from your perspective, how is that, perhaps more damaging to children?
I mean, it is. I mean, the fact that when they're not in school, what are they doing? They're doing more vaping and they're doing more usage. So by giving these exclusionary practices and implementing these policies, we're adding to it. The exact entity, which is a school that is designed to be the safe haven, the safe space for these young people, we're putting them in a situation that is more toxic, more detrimental, impacts their quality of life, impacts their life expectancy, can create many, many other mental, psychological ailments. The list goes on and on. So we are literally feeding the problem. And it's not to say that I am advocating for no consequence. That's not the intent, but we need alternative measures, alternative metrics versus just saying you come to school with a vape pen and I'm kicking you out for 10 days with a hearing. That is just ludicrous to me. And if I'm offending anyone, I'm okay with offending you because I firmly believe in this. That is wrong. That is counter to what any school system should be about. Our job is to care for our young people. That is our job. And we have to work differently to figure out ways to best do that. And putting them out on the streets, sending them home with no support system for many of them. Their support system is a school. Even though they don't realize it and they may not want the support, that's what their support system is for many of them. And we have to find ways to better address this issue and minimize those exclusionary discipline and punitive discipline practices that are harming. And I will say that the students who are most harmed by this are Black, brown, and poor children. And that is a fact that our country needs to reconcile and that we need to do better around.
Yes, that's fantastic. Thank you, Sharonica. I could not agree more with your comments, and it absolutely reflects the experience that we've seen in Minnesota. So my next question is for you, Elizabeth. So the Alliance for a Healthier Generation has partnered with schools for many years now to improve the overall health of students and the whole school community overall. So based on your experience and the incredible relationships that Alliance has built with schools, tell us about how to approach school commercial tobacco policies and what's at stake in choosing alternatives to suspension.
Yeah, and I kind of want to go back to something, Shanika, you were talking about around kind of how stressed the youth are, which I think are just, I mean, it's absolutely 1,000%, true and accurate. And also I would add on top of that, the adults in the environment are also stressed, right? This is an incredibly difficult time for educators too, for a variety of reasons. And what happens to all of us, right? This is not like unique to educators. This isn't unique to youth. This is just like sort of how humans are wired. This is how our brains work, right? When we are stressed, our ability to really deeply think and problem solve and be creative starts to fall offline. And so we fall into these default patterns and habits. And I think as we talk about sort of alternatives to discipline, right, and sort of that more traditional discipline approach, many of us, sort of grew up in the era of, you write a kid's name on the board, you send them to the office, and then you send them out, right? And that was the approach for a really long time. So those are our default patterns. And I think that when we have a stressed workforce, those default patterns are going to come out more and more intensely. And I think if you look at some of the most recent research sort of post-pandemic around discipline, around behavior, and all of these kinds of things, I think that you're seeing that. And how that ties into your question, Rachel, I promise it does, is our approach is really rooted in meeting systems where they're at and really working on kind of this holistic approach. And so I come from the world of trauma-informed practices, and there's this, quippy little phrase, nothing about me without me. And I feel that's the same for policy and practice change at the system level as well, right? You can't come in, particularly as an outside organization, and be like, oh, we have a model policy. Don't you think it's great? And go put it in. What you need to really think about is kind of where are your folks at in terms of what your current policies are, but also you have to implement that policy, right? You have to implement those practices, and that requires mindset shift. It requires capacity building for staff so they understand what it is that they're doing and why. It requires folks that are there to sort of cheerlead on the sidelines and stay the course when maybe you have students, sort of a top tier of students who aren't responding, right? There was a question that came through in the Q&A about we've got some kids that just don't seem to be responding to what we have. And so now we want to go back to our default, which is, well, we'll just kick them out. It's like, well, kicking them out doesn't work. So we need to really think that. So you need to really rally the system supports around, okay, when that happens, how are we sitting and retooling and thinking about those things? So our approach has always been a holistic one. And even from a policy perspective, we'll talk about the model policy in a little bit, but it has sort of like prevention, intervention, and treatment, as well as restoration. And so rather than doing all of those things at once, right, what is the thing right now that we can sort of work on and work together and get in place, and then sort of build upon that and build upon that. But it's a long game. It's a long game, and it's a long game in a system that is already taxed and stretched. And so we do a lot of listening, a lot of learning, a lot of taking the lead, and sort of trying to put things in that way. And Jeff, I saw you came off mute. So what do you got to add, my friend?
No, just getting ready to jump in here. But no, I think that's exactly right. The flexibility and the listening is so important when we're working with school districts. You don't want to come in with a rigid approach or a rigid framework. So yeah, Elizabeth, just completely agree with what you're saying.
I teed up for your question, Jeff.
Yeah.
Yeah, so the next question is for you, Jeff. So with American Heart Association's strong state networks in both advocacy and school programming, how do the lessons about restorative practices inform Heart's work in communities and schools?
Yeah, I'm going to answer that in a couple ways. I think maybe from a couple different perspectives. So first, the American Heart Association works with thousands of schools across the country through our Heart Challenge program. And as Elizabeth mentioned, through that, we're listening to what schools need. And schools want and need support for student and staff well-being, like first and foremost. That is so much the top issue. So with everything we do, we're approaching it through that whole child well-being framework. And Heart Challenge, our program, is framed around helping schools provide students with opportunities for volunteerism and leadership development with a strong focus on students' health. And the notion of restorative practices is perfectly aligned with our focus on student well-being. We recognize that the students are being targeted by the tobacco industry, that to date as a society, we've largely failed to protect kids through policy and through regulatory approaches, and that many, many young people are vaping in response to challenges with stress and depression, as Sharonica mentioned. So supporting school districts in viewing student vaping as an opportunity to provide support to the student and encouraging more schools to implement restorative approaches to vaping is a key priority for us nationally. From a different perspective, I would also say that our experience with state tobacco policy advocacy has been incredibly helpful in understanding why some school districts take a more punitive approach. Far too many states have youth purchase, use, and possession or PUP laws that can include criminal charges, fines, other sanctions for young people who are found with tobacco products. And in some states, school districts view those state laws as like the baseline for their own interventions and work to layer on additional penalties, additional suspension, additional fines, etc. Some school districts even, I believe, falsely believe they're required to refer students caught vaping to law enforcement because of these laws. So the youth purchase, use, and possession laws are posing, key challenges for restorative approaches to vaping in several districts, and are definitely impacting the perception of how those state PUP laws impact school restorative approaches.
Yeah, thank you for raising that issue, Jeff, because I think, thinking about just the school environment is one component to the overall policy discussion that we need to be having around commercial tobacco control. So, I feel like the PUP issue, purchase, use, possession penalties, has been a very important step that many communities have made to remove those penalties and put the focus more on the retailers or those who are supplying these products to youth. So I really appreciate all the work that American Heart Association is doing on that front. So my next question is for you, Sharonica, and you already sort of talked about this and the challenges that students are facing in this year of 2022, where many youth have been out of school, out of the school environment for almost 2 years or much of the last 2 years. So from your perspective, what are you seeing and experiencing with kids coming back into the classroom, especially around this commercial tobacco use issue?
I feel like it's increased, definitely. The research that we're seeing is that from a mental health, social emotional needs perspective, we're going to see the impact of COVID for the next 9 years. And so this is not a sprint. This is truly a marathon, and COVID impacted communities differently. And so one of the things that we talk a lot about in our system is trauma. And there's a study called the ACEs study that may resonate with some of you. The ACEs study is the Adverse Childhood Experiences study that really looks at the number of ACEs that a student or child has and how that number impacts their quality of life, their ability to focus at school, their ability to be successful at school, their ability to thrive as adults. And so it has increased. And we are really working to find other ways for students to cope and to navigate the stressors that they're dealing with day to day. So things like de-escalation strategies. Our restorative practices work is a shared work with students. So we have restorative practice leaders who are able to support their peers, practicing mindfulness, things like yoga, which might seem very cliche, but it is a strategy that can be effective. Focusing on diet and what we're putting into our bodies to make sure that we are healthy physically, which in turn impacts our mental capacity to be effective. And then helping educators. This isn't I always say it's not a rosy picture, because some adults do want those rigid protocols and rigid approaches. So we're really educating the adults and the educators and families and community around the why behind our restorative approach. It's not that we're being, loose and that we're not holding people accountable, but we're just looking at that accountability through a student-centered, because we're an academic institution, a student-centered, student-focused lens.
Great. And there actually was a question posed in the Q&A that I think, this might be a good opportunity to raise up one of those questions. The question was, what do you do to help those repeat offenders or those with these interventions that don't seem to be helping them stop using or, having the products in schools?
When we think about even the words that we use, and also the offender term has a very, school to prison pipeline connotation. So we think about our children as children, the children who have repeatedly used tobacco or brought in those types of devices such as vape pens and things like that. And we ask the question, instead of saying, what is wrong with you? We say, what happened? Something's happened. Something is happening. And oftentimes there are very few students where it's just a blatant disregard for the rule. There's a lot that is happening. And we have to ask more questions. We have to work in tandem with their support system. We've done home visits, and what we found is not only is the child addicted, but the parents are too. So we use an agency called Preferred Family Health. That is a facility, it is a drug prevention facility. We're able to partner with them to get students, we've had students that have been admitted to have those types of cessation learning in classes and just a plan to help wean them off and giving them alternatives. We also work to educate them about how it impacts their body. They think about it as the right now hit, the right now cool thing to do. I can post something on my IG account, Instagram, for those of you who don't know, but they can post that, they look cool, they get some cool points, but down the road, this is how it's impacting your brain. This is how it's impacting your heart. This is how it's impacting your lungs. This is how, by the way, it can impact the amount of years that you live on this earth. So it's a heightened education campaign. And we also try to highlight our success stories. So having students who can talk to their peers about their journey, those students who were frequently at a hearing, that now with our new approach, they have a different perspective and a different outlook. So they can in turn talk to their peers and talk to their classmates about their experience. So those are just a few, but there's no silver bullet. Every student is different, every approach is different, but you have to have a menu because this is a big, massive issue and you have to address it and attack it. It's like an elephant. You have to eat it one bite at a time. And if this one doesn't work, we try another resource. If that doesn't work, we try something else. But it's never the option to give up on children and throw them away, period.
Yeah.
That's not the option.
I 1000% echo that. And just want to add, I think there are kind of a couple of ways in which that it's important to think about this, right? So oftentimes we think about like a policy violation as a discrete event, and then the next policy violation as like another discrete event, and then another discrete event, and another discrete event. But I think it's really important to think about like, and I think Shanika, you mentioned this earlier on sort of like frequency and intensity and all those kinds of things. So for example, if I refer a student for an intervention, right? So they're getting a brief intervention where we're really trying to focus on kind of what is the root cause of, like Shanika said, like sort of what is going on here that's driving and motivating you to engage in tobacco use or kind of any substance really. And so we can start thinking about like, okay, how do we do some harm reduction there and how do we get moving forward? Now, so if you have violations of the policy in sequence in the middle of that intervention, that to me is a flag for the system to go, whoa, something about our intervention's not working. We need to stop. We need to retool. We need to rethink. Conversely, maybe you have a kid who had a violation, right? And then things are going okay. And then they have a violation again a couple of months later, let's say. And I think that's a great time to sit and pause. And again, what Sharonica said, really sit and go, hey, things were really going well. I was really proud of you. You were really proud of you. What happened? What's different right now? And that's like Sharonica said, oftentimes when you start to uncover, wow, this was stressful, or I fell back into this. And then I think kind of reemphasizing this, whole community approach. And I think sometimes I do this too, right? Like schools are a good place to do intervention, with kids. And we aren't the only place where kids live and learn and play and work. And we aren't the only influencers. We are a influencer, an important influencer. But we also need to sort of bridge out to the community resources and supports, bridge out to the families as well. Like Sharonica was just saying, so that we can sort of empower the whole community to be around and rally around the same solution. And so, just really want to like underscore exclamation point what Sharonica said about sort of giving up isn't an option, because we know giving up's not going to have the change that we all want. And there's not an educator on this planet that's like, oh, you know what I really want? I want my kids to fall into substance use or into addiction or to not graduate from school or whatever else. And so I think it's just trying to remind folks of what our big goal is.
Yeah, that's great. Thank you, Elizabeth. And I'm really hearing a theme from all three of you of this is a marathon, it's a long game. And, I think to that point, schools we know are really strapped for resources right now. And so, Jeff, I wanted to ask you, what are some of the challenges and barriers that schools are encountering as they're trying to implement these types of policies and move forward in this direction? Like I think Sharonica said, there's no silver bullet here. It takes time.
And a school superintendent who was not named Sharonica Harden-Bartley, I will say, a school superintendent once told me it's cheap and easy to suspend a kid caught vaping and takes time and resources that we don't have to support a student. So that was the mindset, the mindset of that administrator who wanted to do the right thing, but wasn't aware of how to do it. So yeah, I think, it's our job to help schools understand the importance of restorative approaches and to work with them in a really solutions-oriented framework to implement those approaches. And fortunately, there are many ways to implement restorative approaches that are easily implemented and inexpensive. And again, the key is to work with schools to identify which approaches best align with their existing approaches and their existing culture, rather than asking them to reinvent the wheel or to implement a very specific approach. So with the American Heart Association, and as Elizabeth described with the Alliance, rather than focusing on rigid recommendations, the Heart Association focuses more generally on the 5 key components of a tobacco-free school district. And I won't go into those today, but they're outlined in our Tobacco-Free Schools Toolkit, which I believe is linked to in the chat. And the toolkit, identifies the reasons why we believe each of those components is critically important. So then we work with each district individually to determine how it can best implement those 5 components. And of course, kind of where the rubber meets the road, the most important component is what actions schools take when a young person is found vaping or violates their tobacco policy, and how important it is to establish that restorative disciplinary approach. So for restorative disciplinary practices, for example, schools typically have a code of conduct or a student handbook that outlines disciplinary responses when students violate whichever school policy. And there are probably as many code of conduct approaches across the United States as there are school districts. So it's very important to work with each district individually. We've found that the best approach is to work with districts to understand how they approach their code of conduct, how it's structured, and then to work within their existing codes to address vaping in a more restorative, supportive manner. So as an example, some districts use a tiered system for student behaviors, certain behaviors being addressed in a more supportive ways and others being addressed in more punitive ways. With those districts, we work to reclassify tobacco use and vaping as an issue to be addressed, through those more supportive and restorative ways. There are some school districts that have classified tobacco use and vaping in the same category as violence and bullying and so on. And we believe that student vaping is the result of industry targeting young people, the lack of effective regulation, and the fact that young people are dealing with a lot today and vaping, again, for stress, depression, etc. So with vaping specifically, we're also reaching a point where there are several alternative to suspension and cessation options for schools, which are offered through several modalities, classroom-based, text-based, online programs, etc. Many of those are inexpensive. So we present schools with a range of options, the 5 components of an effective tobacco-free school, and a range of options with regard to restorative programs and practices that they can implement, and then work with the schools individually to integrate those approaches that best again match their culture and their existing approaches.
Thanks, Jeff. And Elizabeth, do you want to add anything about, since the 2 organizations really partnered to create this whole amazing toolkit? Do you want to mention any of the other resources?
Oh, sure. Happy to. So like Jeff said, we have partnered together. We're very fortunate over here at Healthier Generation to have a really robust online action center. It's free for any school and district that want to use it. You just make an account. And within that, we've got a couple of key things that may help support the work in this area. One is the mild tobacco-free policy, which we also have what's called a policy builder. And so you don't just have to take like a PDF and then print it out or remake it. It'll actually allow you to drag and drop certain components of the policy based on what your district administration and what your school board wants. And then they can literally just have that into whatever board docs or whatever the management system that you use for policy. So it's kind of a nice way to do that. We have the tobacco-free schools assessment, which allows you to check fidelity of your policy to see yes, are these important components in, yes or no? And then an implementation component that says to what extent are you doing these things? To what extent do you have a trauma-informed approach as it relates to commercial tobacco use? To what extent do you do restorative approaches? And it gives you some really tactical examples of what that looks like. And then everything is connected to a resource. So in the Q&A, there's been a lot of questions about resource. So every question within that has a resource that's related to it, attached to it. So we have a restorative conversations guide, for example. So Jeff referenced free and easy. That to me is the lowest lift. It's how do you talk with kids in a restorative way, right? Just a little quick document that helps you do that. So each of the questions have resources attached to it. We also have folks that are available to support schools and districts who may want additional technical assistance and support. So we are here. Same with all the other partners that are on this call. So that's my plug.
That's awesome. Yes.
Thanks,
and
Rachel.
It is really an amazing set of resources that your organizations have created. So my next question for you, Sharonica, is, so you're practicing these restorative practices in your district. What are you seeing with child outcomes and how is it benefiting the students?
So I think that it is a journey. It's a marathon, not a sprint. But immediately, our students were involved in writing our discipline handbook. We actually changed the term. It's now the Student Expectation Guide. We partnered with the ACLU and the League of Children's Services to make sure that our language was, again, restorative. We adopted fully the language of the American Heart Association. We're still working through the procedural pieces. It is an education piece of working with the adults as well. We see students that are more engaged. We've had several students and families that have gone through our preferred family health plan. to provide them that support and assistance. And our infractions for tobacco use and vaping have been reduced. We have another issue that I will say for another topic. Now that marijuana is legalized, we're dealing with that too. But for this particular topic, we're definitely seeing decrease in our students, the usage, and more awareness, more education. Our students are also becoming ambassadors as they talk with their peers and their families and their community around this important topic. I think the student voice is so important. And that is the root of restorative practices, doing things with people and not to them. And so we can learn a lot from our students if we would just take the time to ask them and then to listen.
That is brilliant. Yes. Listen to the kids. So our last question, we have just 3 minutes left. So I'm going to turn it quickly over to each of you for 1 minute. How can public health professionals, parents, advocates, volunteers, like all the volunteers who are involved with PAVE, how can they help and support districts in adopting and moving these kinds of policies forward? And I'll start with you, Elizabeth.
Yeah, I mean, I think, you know, sometimes I think the simplest solution is the most effective one, which is get involved, right? Engage with your schools and districts, engage with your administrators, engage with your school boards, ask questions, right? What is our approach for when kids get caught, right, with a vape pen, for example, or what is our approach to discipline in general? And talk to me about why that is, and try to do some fact gathering there, and then have some conversations with folks around what it is and what you want to see. And I think parent voice, as Shaunaka talked about student voice, I think parent voice is also extremely important in terms of, hey, this is the type of community we want to have and we want to see. And so how do we rally our other, your other parent supports and those things to make those changes happen? And then like Jeff said, I think there's some legislative things both on the state and federal level that would be really critical, because at the end of the day, the getting caught is like the most downstream intervention, right? It's like it's already occurred, it's already happened. And so we're in there in sort of this like prevention, early prevention, a little bit of mitigation and restoration space. What would it look like to go really upstream and think about what does it mean to have significant legislative change around marketing, around all of those kinds of pieces? So I think that there's some legislative components there too that community and family advocates can participate in.
Great, thanks, Elizabeth. And Jeff, do you want to address that question?
I mean, largely just to echo what Elizabeth just said, I think schools would really appreciate all of us getting involved and connecting with our policymakers, our elected officials, to ensure we have the strongest policy, protections in place for young people. That'll minimize the issue that they're facing in the schools. Second, just get involved. Whatever that looks like for you, get involved with your school, get involved. Going back a couple years, the weekly newsletter from my son's high school started with, to date, the Andover Central High School has contacted law enforcement X number of times for vaping related violations. I saw like that and immediately got connected with the school principal and just had a conversation just to understand what they were doing, what they were going through, and fortunately they kind of changed their approach. But yeah, just get involved, whatever that looks like for you.
Great, thanks, Jeff. And Shaunaka, I want to give you the last word as the person who is working every day with our kids. What are your thoughts on how we can support you in getting this work done?
Let's keep pushing the policy work and I can take it from there. Thank you for your support. The research and the policy gives us cover and both are very compelling. So thank you.
Great. And thank you all for participating in this panel today. And I know there were a lot of questions in the Q&A that we're happy to follow up, reach out to any of the four of us, and we're happy to follow up to help answer those questions. And with that, I will turn it back over to the PAVE hosts. Thanks.